We're going to take a look at an active knee flexion assessment. To perform this assessment, you're going to need something soft to rest your knee on. Here I've just got like a foam yoga block. We're going to set ourselves up in this half kneeling position. We want to focus on a posterior pelvic tilt. So we're squeezing the glute and we're tucking the tailbone under on this side. Then we're coming forward just slightly. You'll see there's a nice straight line that goes from knee to hip to shoulder here. The hands are going to go on top of this knee and the rib cage is coming down. So I'm just bracing that midline. So glute is switched on, abdominals are switched on. And we're trying to maintain this pretty sort of flat or slightly flexed spine. From this position, we're going to contract the hamstring and lift the heel as close to the butt as we can while keeping this glute contracted and the hip extended. How close can you pull the heel to your butt? Now this can cause some cramping, so do your best to work through it. A common mistake here is not to extend the hip. So we end up in a position where the hip is flexed and we're doing the lift in this position, which is not what we're after. We've got to make sure the glute is contracted and we're coming forward in this position and that nice straight line. As you lift up, we don't want the hip to sit back. You've got to keep that hip pushed forward, okay, and be able to close. We're trying to close that angle between the hamstring and calf of that leg. You only need to hold it for around about 10 to 15 seconds so we get a clear perspective of how close you can get that heel to your butt, and then you'll switch and repeat on the opposite side. When you're filming this, you want to film it from a direct side view so that we can see that angle between the hamstring and calf of the leg that you're testing. And this is the Active Knee Flexion Assessment Test.